You know, back injuries are the most common cause of career-ending injuries for EMS providers. And now we're starting to see power cuts and loading devices and slide sheets. But think about it, when we need to lift somebody from the ground to the gurney, that's really the critical danger zone. Well, the product I'm going to show you today has this great innovation that's going to help us with that. I'm Chris Cebollero, and this is the Innovation Zone. You know, you hear it all the time. We're just one backboard lift or stretcher lift away from ending our EMS career. As a matter of fact, in a recent survey, 48% of workers that were polled said they had some sort of back injury in the past 6 months, and they weren't even reported. So now, what we need to do is we need to think about how do we keep our employees safe while they're lifting, especially from the ground to the gurney. You know, when I first became the chief of Christian Hospital EMS, we were spending about $21,000 average on soft tissue back injuries, not to mention the injuries that were more severe that could get upwards into the 6 figures. Today I'm very excited to show you this new and innovative product from Easy Lift Rescue System. It's a backboard, but it's really more than a backboard. It really is a whole lifting system that I'm excited to share with you. So let's look at some of the specifics of this innovative new product, and I'm really excited to show it. When I first saw it, it really kind of piqued my interest in saying, this is really revolutionary. So the first thing that I want to tell you about is the new material that it's made with. It's really a high density type of product that allows us to have a bigger weight ratio than you would have with a normal board. Think about it. How many times have you picked up a backboard and the patient kind of sagged in the middle? Well, if you go ahead and look at this board, it's a little bit thicker and it allows for better rigidity when it comes to taking care of that patient so you don't have that bow in the middle. One of the other things that's really great is these larger hole handles, and this way it gives you a better opportunity to hold on to, and your hands aren't hitting the board as they would in a traditional board. I think that's a really great concept. Think about our typical backboards. They're flat, they give a poor patient experience. How many times have our patients said that the board has actually caused them more pain sometimes than the injury they sustained? But what's really great about this new design is it takes the patient's comfort into account. So if we look at it, first off, the board is concave. And what that does, it allows to take those pressure points off those areas that patient would normally have. Another great component of this is the slots that are in the middle of the board. What this does is it reduces friction and keeps the patient from sliding back and forth. And how many times have we seen our patients that we buckled into those backboards that actually move as the stretcher moves or as we carry them to the stretcher? Another great component of this I think is really revolutionary is it comes with its own headbed. And what this does is allows the patient's head to rest in comfort and help unweight those pressure points. And the new patient design allows for better patient comfort, it reduces pain, as well as reduces possible tissue breakdown as well. Now I know what you're thinking. In the beginning of the show we talked about a new lifting product, and what I've showed you kind of looks like a typical backboard, but this is way from typical. And what's really great is I'm going to show you that lifting component right now. So when we think about lifting a traditional backboard, we really kind of have to get down into that bucket squat to lift it up off the ground and get it onto the gurney. And that really puts us into that critical danger zone of getting a soft tissue injury in our back. So really the innovation and what's revolutionary about this device is the lifting handles. And let me go ahead and show you those. At the bottom and at the top of the board, you'll see that there's some green handles. What's really revolutionary is you could actually pull these handles out and it will allow you to have better ergonomics when you're taking the patient off the ground. Now you notice that the handles are stowed, but go ahead and pull these handles out and it gives you the opportunity now to use these handles to lift. So now you're not getting into that critical danger zone where you could have a soft tissue injury. And these retractable handles are held on by the same material that our seatbelts are made from. And each strap is rated for 1,700 pounds. And now what you have is the ability to keep proper lifting technique to get the patient off the ground and onto the gurney without causing soft tissue injury. When we think about the Easy Lift Rescue System, it's truly innovative and is truly revolutionary. And if we think about it, being on scene, we've always had those calls where we have to get down really low, we have to lift the patient up, and we can always feel that pull in our lower backs. But now, with this truly revolutionary lifting system, now we have the ability to keep our patients safe and to keep our employees safe. I'm Chris Cebollero, and thank you for joining us on the Innovation Zone.